you might target a branch of the vagus nerve called the auricular branch of the vagus nerve, but there's no excluding the possibility that you've also activated other nerves.
Well, you mentioned the book. One of your colleagues, it stimulated his bladder. He had to run to the bathroom.
Yeah, we don't know how that happened, but it's a true story.
Yeah.
And when you look at applying electric current into the neck, first you have the skin, then you have the fascial layers under the skin, then you have and the platysma muscle, then you have the sternocleidomastoid muscle, and then you have a sheath encasing the carotid artery and the jugular vein and the vagus nerve. And then you have the vagus nerve.
I get it now. No, I get it. I'm getting the clearer picture. So yeah, I mean, because it sounded great in theory, and it's exciting because obviously I'm not saying, implanting a chip on your vagus nerve is not a bad idea if you're suffering terribly. But of course, in medicine, we strive to do things more non-invasively, if possible.
I think there's a caveat there too. So I agree with you, of course, if possible, but you have to look at the whole picture. So now you have a condition like rheumatoid arthritis where patients, first of all, they're suffering, despite the fact they're taking invasive medications that are immunosuppressive, cost $100,000 a year, and work half the time and have a huge range of side effects. So it's not the risks of invasive versus non-invasive. It's the risk of treatment and benefit versus poor treatment and no benefit. It's a totally different calculus.
Yeah. Okay. Let me ask you this too, because you mentioned the book. It's kind of interesting, and you mentioned you do in your own life. I've also done a lot of training with, fortunately, really good places. Like back in the day, actually, I went up to Harvard and did one of the workshops with Dr. Benson, who worked on something called the relaxation response. And he was very big on meditation or prayer. I prefer prayer. You talk about in the book about the cold plunges, and you did some work with Wim Hof, who's known as the Iceman. I've heard of him through Tim Ferriss. These are definitely not devices. They're, what we would consider the holistic, and some of the people call it the fuzzy wuzzy stuff. But you mentioned you do this in your own life, and that it seems to bring you feel better, a happier place. Can you expound on that a little bit about if you think the value of doing some of this if a person's so inclined?
I believe that, as we discussed a few minutes ago, there are some basic health principles that converge on slowing heart rate and lifestyle interventions that focus on reducing stress, anxiety, and quote unquote increasing relaxation, which also converges on slowing heart rate. And I believe that the evidence is that those interventions, those practices are associated with better health span, with better lifespan. However, before we get into the specifics of what I do, I think you would agree with me that one has to always be really careful on